You're going to take out your trusty reflex hammer, and you're going to say, huh, I'm going to run this over your skin, and it's going to feel like this, okay? And I'm going to do the comparison side to side, all right? And I'll be asking you questions as we go. So I'm going to have you close your eyes when we do this. You always want to have your patient close their eyes. Now, when we're doing the dermatomes here, we're just going to start at 12, and that's going to be about the iliac crest. So we're going to do, does this feel like this? Does this feel like this? And then, of course, we're going to come this way. Okay? So I'm going to come here. Does this feel like this? And does this feel like this? And does this feel like this? Okay? Now, along with the dermatomes, we also want to check the peripheral sensory nerves, right? Hopefully you guys remember. Peripheral sensory nerve coming down this way. The first one is what? Does this feel like this? And that is what? The anterior femoral canes. Very good. Over here, does this feel like this? What is that? Very good. And does this feel like this? Which one is that? Operator? Okay, very good. So we've done our temperature and our dermatome. So in conjunction with the dermatome, we're checking for sensory, because as you know, sensory does not always follow a dermatome, so we want to figure that out. And so, yes, you need to remember all that little bit of information that we've done in Ortho and Ortho 2. I know I warned you back then, but you need to know it just because you need to know it. Okay? Okay, next thing we're going to do is is it bony palpation? Okay, so we're going to do our iliac crest, our ASIS, our AIIS. We're going to come across to the pubic bone. We're going to come over here to the greater trochanters, and then you can just come down the femur. Okay, has everybody got that? Okay?
Yeah.
All right.
My muscle is tender right there. I don't know why.
Well, yeah, and that's, you find all kinds of things. And you can always say to your patient, if anything hurts or causes you discomfort while I'm doing this, please inform me of that. And that's okay. Okay, the next thing we're going to do is our soft tissue. In our soft tissue, we want to look for things like lymph nodes. We want to look for like bursa. We want to look for ligaments. We want to look at muscles and things like that, okay? So we'll do the inguinal lymph nodes, and you're going to do hand on hand, and you do not reach across when you do this. You only examine the side that you're doing. So you're going to come down like this, just moving around just in this direction here, then you're going to move to the other side. Any type of issues with the lymph nodes, right? Has everybody got that? You're going to compress over the bursa here. Which bursa is this, and which bursa is this? Does anybody remember? The other pectineal and trochanter. Okay, so then you're in bursa. One of the chief tendons that you're going to look at here comes from the ASIS down to the pubic bone, and that's what? No. The inguinal ligament.
Oh,
the inguinal ligament. Okay, and that gets involved with what? Anybody remember? Neuralgia paresthetica. That's where you can get entrapment. And one of the treatments for that is just some cross-friction massage over top of that ligament. Next, you want to do the muscles, the chief muscles we want to do. Remember, we were talking about them cause people problems. The psoas muscle gets real tight, so you'll just come down here, and you'll palpate right down through here. And, of course, palpate on the other side. And I also think it's a good idea to go back to the ASIS and what attaches there, sartorius, and then the AIIS. So the sartorius will come down this way, your rectus femoris this way. I don't care how far you follow the muscle necessarily, but I want you to definitely look at the origins of the muscles. Okay, has everybody got that? But if the patient says to me, hey, this is tender like she did, I'd probably follow that muscle further, right? And just try to isolate the simple thing. All right, so after we've done that examination, we're going to do our ranges of motion, our active, passive, and resisted ranges of motion. Now, when your patient's doing these, you want to make sure that they're doing them and not, and that they're stable on the table, and so that you're getting a good motion on this. I'm not interested in numbers on this. To be honest with you, I don't know the numbers. I've looked at them 500 times, but what I am looking for is what? Right, I want to make sure that the patient is kind of even on from side to side. So the first thing we're going to have our patient do is I'm going to have you, if you would flex your hip, thigh all the way up to your chest if you can. There, no, no helping. Just like that. Very good, thank you. And you can put it back down. And can you bring the other one up? Very good, and take it back down. Did anybody notice a difference on that? This one came up further, probably because she stressed it with her hand. But you want to make a note, if this patient was in exam shorts, she probably would have had a better range of motion. You know, jeans, tighter pants on, that's not really what you want to do.